Hi, my name's Thomas Stachin, and I'm a sophomore studying bioengineering.
Hi, I'm Adriana Purcell. I'm a junior in the college studying medical anthropology and Hispanic studies.
Everyone, I'm Omar Husni. I am a junior in the College of Arts and Sciences studying medical anthropology and global health through health and societies.
Hi, I'm Daniel Cargilis. I'm currently a senior studying neuroscience.
Hi, my name is Valentina Spadia. I'm a sophomore in the college studying anthropology and English.
Hi, my name's Kayla Johnson. I'm a junior in the college studying public health with a minor in medical anthropology.
This summer, we partnered up with Sayre Health Center in Cobbs Creek in West Philadelphia to answer one big question. What are the community perceptions and needs regarding health barriers and assets in the catchment area of the Dr. Bernett L. Johnson Jr. Sayre Health Center?
So to answer this question, we employed a mixed methods approach. And so we conducted semi-structured interviews. We were aiming to collect 200 patient interviews. And we are going to use these to inform a wider scale survey, possibly with 1,000 participants.
And this summer, our focus has really been on maintaining cultural competency and making sure that our interview guide is an appropriate one to be asking, because a lot of our questions are regarding sensitive information. So we have workshopped the interview guide with community liaisons from the Sayre Health Center, as well as clinical social workers from Sayre Health Center, all to really maintain the focus on what the community perspectives on and making sure that we are appropriately addressing health concerns.
Throughout our study, we did come across a couple of challenges or barriers, and one that mainly stood out for our study in particular was having COVID-19 precautions and how that prevented geographic random sampling. So as a result, usually door knocking was a method to gain participants, but since that was no longer a viable option, we overcame these barriers by utilizing key informants, social media, and local businesses to broaden our sample size. In addition to that, due to a pandemic, I think a large challenge or barrier that we helped overcome was just being resilient and working together in these challenging times to work remotely in something that was very different than what we were used to doing as a team.
However, we definitely grew from these challenges, both as individuals and a team. And as we progress, we are continuing to work on this project throughout the fall. We are maintaining our goal of conducting the 200 interviews with the community liaison approved guide in order to inform our future survey. That will allow us to draw an asset map of the Cobbs Creek health landscape and to determine the factors that affect the social determinants of health in the area. We will then be using these results to inform the care and programming of Sayre Health Center as we originally intended.
And of course, as we are a team that is currently prioritizing the anthropological perspective and trying to understand community voice in terms of implementation of specific evidence-based health services, as Valentina had touched on earlier, we do have some amazing acknowledgements and people who have really helped us through this time as support for ourselves during the COVID-19 pandemic and also as study support. And of course, as Tom said, the study is ongoing. So some of these acknowledgements definitely include the University of Pennsylvania, the medical school, Perlman Medical School, also Dr. Francis Barg, Dr. Kent Brame, Sayre Health Center, all of the community liaisons over there, Dr. Vernon Gray, and Ms. Jane Morris, who is the executive director of CURF, have been of great help. And of course, UPenn Anthropology, thank you for giving us these wonderful perspectives that we are able to employ in and around the UPenn neighborhood. So thank you.